everyone, my name is Pari Jain.
And my name is Nithish Prakash. Today we'll be discussing the prevalence of congenital syphilis in developing countries.
It's an infection that has many treatment plans, but its prevalence is driven by systemic issues such as geographical disparities and social issues rather than scientific ones, making it an important global health issue discussed today. However, before diving into that, allow me to give a brief introduction about who I am. I'm a rising junior attending Desert Mountain High School located in Scottsdale, Arizona. So my prominent extracurriculars include being a medical scribe and a research assistant for an OB-GYN, where I'm able to conduct research regarding sexually transmitted infections. I'm also a research assistant at the Southwest Kidney Institute as I've been part of various clinical trials. I'm the co-founder of a nonprofit known as Project Haven, where I've been able to raise thousands of dollars for the homeless population in our valley. I'm the vice president of the Science Olympiad, and I'm a member of the Phoenix Youth Symphony as I've been playing violin for over 10 years. So my future interests include being an OB-GYN, ophthalmology, and public health.
My name is Nitish Prakash, and I'm a rising junior at Base of Scottsdale. Some of my notable extracurriculars include being a research intern at U of A Medical School, where I'm currently using R, a programming language for differential gene expression analysis. I'm also an intern at ASU, where I'm performing studies on viral detection, a co-chair of Students Supporting Brain Tumor Research, which is a nonprofit organization raising money to fund brain cancer research at multiple hospitals, a captain of my high school speech and debate team, and I volunteer at Phoenix Children's Hospital. Some of my future interests include public health, neuroscience, and oncology. For some background information, in 2022 alone, over 8 million cases of syphilis were found in ages ranging from 15 to 49 years old. And it's not just in 2022. In fact, in the last decade, cases of syphilis have only been increasing around the world. Even in first world countries where we expect cases to have a downwards trend due to the availability of services and resources, cases have only been increasing. For example, in the United States, cases of syphilis increased 80% from 2018 to 2022. Now, before diving into the disparities that are causing these problems globally, what is syphilis?
Syphilis is a preventable and treatable sexually transmitted infection or an STI which can spread through sexual contact, broken skin, mucous membranes, or even blood transfusions. Many with syphilis face dormant symptoms, meaning it does not appear obvious to be infected at first. However, a regular blood test can detect dormant or latent syphilis, showing us that these regular checkups can play a large role in preventing long-term adverse effects. If the syphilis goes untreated, it can potentially harm the brain, heart, and other major organs. Of pregnant women with syphilis, between 50 to 80% of these cases result in birth defects. Additionally, pregnant women with syphilis are 12 times more likely to have children with those birth defects. Now that we've discussed syphilis, let's dive deeper into the focus of today's topic.
Congenital syphilis is a severe life-threatening condition which occurs when a pregnant woman carries that untreated syphilis and transmits it to her unborn child. Over 700,000 to 1.5 million cases were reported globally between 2016 to 2023. But the problem, as mentioned before, doesn't lie in science. It lies in systemic barriers. Penicillin is an antibiotic that is a common treatment for syphilis, but what's not so common is its availability in developing countries. As we can see in the diagram to the right, about 85% of congenital syphilis cases persist due to A, untimely testing, or B, inadequate or incomplete treatment.
When considering the global makeup of congenital syphilis, we can see that 90% of these cases were found in low-income nations or developing countries. Populations with these countries are strained in their access for antibiotic treatments. If we look at both these maps, we can clearly see the correlation between high rates of syphilis and low per capita health expenditure. Specifically, African, Latin American, and Southeast Asian countries are the regions with the least per capita health expenditure and the highest rates of syphilis recorded. With this information in mind, it's no surprise that congenital syphilis is a pressing global health issue that's fueled by geographical disparities.
Let's take a moment to look at the impacts of these problems to understand why congenital syphilis is so important. In 2022, there were 150,000 fetal deaths in stillbirth cases, 115,000 newborns clinically diagnosed with congenital syphilis, 70,000 neonatal deaths, and 55,000 preterm or low birth weights as a result of a swollen placenta in these pregnant women, disrupting its regular function and transferring energy and oxygen to the baby.
Having discussed some broad reasons for the prevalence of congenital syphilis, let's move on to some in-depth factors. Firstly, antenatal detection is a big problem in these developing countries. Of the 5,593 facilities that offer antenatal services in Africa, less than 1 in 3 of these facilities offered care before 4 months gestation, which is the ideal form of treatment. In fact, if treatment starts during this critical period, treatments are 98% more effective.
Secondly, stigma plays a crucial role in the adverse impacts of congenital syphilis. The fear of social repercussions unfortunately bar individuals from seeking treatment and screening. So far, we've talked a lot about antenatal detection, but what about after syphilis is detected? Unfortunately, most facilities in developing countries don't offer continuous treatment to fully fend off syphilis or finish their course of antibiotics, resulting in its transference from the mother to the baby.
To illustrate this lack of treatment, let's look at a statistic from East Africa. For pregnant women in East Africa with syphilis, only 8%, shown as 4 and 50 in our graphic, receive treatment. It's important to note that I said receive and not finish, meaning we don't know how many actually finish the treatment. That being said, it's more likely than not that less than 8% actually receive and complete their antibiotic treatment for syphilis during their pregnancy.
Having discussed a lot of the problems that make congenital syphilis a pressing global health issue, it's important we also derive our solutions from those same problems. For one, we must educate the masses on STIs and how harmful the outcomes of syphilis may be in order to battle stigma. Secondly, we must increase access to screening and treatment services. A study published by the National Institute of Health found that without building more clinics and by simply introducing behavioral reforms for physicians and staff at a clinic, it can improve treatment services. Now, if we took that a step further and introduced those reforms on top of building new clinics in geographically remote areas, syphilis treatment during pregnancies would improve greatly. Finally, it's important we take notes from successful initiatives of the past and implement them in our area of the world today. So let's take a look at one of them.
Cuba is a prime example of a nation that overcame the struggles of congenital syphilis. Starting in 1974, Cuba's health program began fighting syphilis and reduced the amount of cases from 164,000 reported cases to 0.5 cases per 1,000 live births a year. Their program provided free and universal prevention services while also creating awareness through communal health education, expanding free access to screenings, and strengthening their infrastructure. In fact, Cuba invested heavily in the social marketing of condoms, one of the many factors that contributed to their success. Some other initiatives include the National Association of County and City Health Officials, or NACHO, and the Pan American Health Organization, where they also both have fought congenital syphilis by collaborating with the local health departments to increase access to resources like regular screening in nations such as the United States, Bermuda, Cayman Islands, and Cuba.
To close this presentation, let's look at some key takeaways. A study from the same NIH says that for a well-established health system, the report of a single case of congenital syphilis is an embarrassment. We should all hope that in a few years, this is the case for every country. We've seen that there are multiple ways we can address these problems, from primary prevention in the form of condoms and regular screenings to increasing the availability of treatment services in the form of behavioral reforms. Given support from international organizations, these countries can reverse the prevalence of congenital syphilis. Finally, through educational programs like NACHO, we can show the general public that shame may be fatal. Thank you for taking the time to listen to our presentation.
We'd also like to acknowledge the Johns Hopkins Global Health Leaders Conference for allowing us to present about this pressing global health issue. Rod Rothi and OB-GYN I work with, our families, and everyone else in the audience who listened to our presentation today.
Here are our references, and here is our contact information. Thank you.